Hello, I'm Dr. Cesunica Ivey, and I will discuss equity, access, and community engagement as it relates to pandemic prevention and human behavior. I will first discuss the systemic inequalities that were observed during the COVID-19 pandemic across multiple sectors. I will then discuss the application of Internet of Things for environmental monitoring in underserved communities. I will then relate those lessons learned and put forth recommendations for equitable pandemic prevention in the future. First, I'd like to discuss a recent article in the Los Angeles Times that discusses the inequities surrounding the COVID-19 vaccine rollout. As we can see in the figure on the right, there were more white and Asian vaccinations for people aged 65 and older with at least one dose, compared to the same for Native American, Latino, and Black populations. This is despite the fact that we saw higher rates of mortality for COVID-19 across the Native American, Latino, and Black population. In another example of vaccine inequality, we see two examples of the vaccination rate versus the case rate. For example, for the community of Paramount, the median household income is $57,000. The COVID-19 case rate is 1 in 6, the death rate is 1 in 505, and the vaccination rate is 1 in 16. Conversely, for the Palisades Highlands community, the median household income is $202,000, the case rate is 1 in 30, the death rate is 1 in 3,846, and the vaccination rate is 1 in 4. This is a clear demonstration of vaccine inequity across socioeconomic status in Los Angeles County. Next, I'll discuss the pandemic inequities across multiple sectors. First, we witnessed lost wages across the service industry, which is commonly the industry for which are lower wages. Also, we saw an inequitable representation of African Americans in COVID-19 vaccine clinical trials. We also saw increased maternal morbidity for mothers from underserved communities as well. All of these impacts were amplified across Black, Indigenous, and other communities of color. I will now discuss the correlation between environmental and COVID-19 vulnerabilities. For example, in the Los Angeles area, once again, we see the correlation between the overall environmental vulnerability, where the higher vulnerability is in red, and overlaid over that are the COVID-19 population adjusted case rates. We see here that the highest COVID-19 case rates are seen for locations with higher environmental vulnerability. Unfortunately, this community has already been designated as a community at risk for high air pollution exposure disparities. The Los Angeles area, along with the Long Beach and San Bernardino Muscoa communities, were identified as communities that need additional resources for air monitoring, as well as emission reductions as part of the Assembly Bill 617 implementation. Further, we see that those communities are they coincide with the cancer risk that is calculated every few years as part of the multiple air toxics exposure study conducted by the South Coast Air Quality Management District. So we see that the COVID-19 vulnerabilities and disparities are actually are occurring, especially in Los Angeles, in communities that are already historically burdened. My colleagues and I were interested in the vulnerability in the inland portion of Southern California. So we analyzed the data for Western Riverside County. We actually saw that the COVID-19 cases were more prevalent among Latinos in Western Riverside County. The Latino population also lived in locations with higher overall environmental vulnerability. We also discovered that the overall percentage of essential workers within this part of Riverside County were from the lower SES and highly vulnerable non-white neighborhoods. Therefore, we concluded that, at least for our area, essential workers should be a prioritized and protected class in the future due to these compounding environmental and socioeconomic stressors. So overall, we found that the overlapping nature between environmental health and socioeconomic disparities really could be defined by two factors, and that's race, ethnicity, and surprisingly, land use. In terms of land use, historical policies actually constrain the land ownership for non-white citizens, and this is informally known as redlining. And we see that this redlining correlates with all sorts of inequities that we see today. Historical FHA policies determined in the past and actually determine sometimes now one's zip code. And this is evident in informal agreements known as racial covenants, which put constraints on who can buy certain parcels of land. Further, within a specific city, the land use and zoning classification is controlled by those city officials, and therefore any upzoning in underserved neighborhoods is controlled at the city level. What we see is that there is deliberate exacerbation of these disparities in the form of upzoning, and upzoning is, by definition, the change from a less intensive land use to a more intensive, heavy commercial and industrial land use. And we see, unfortunately, that this tends to occur more frequently in Black and Brown communities. Consequently, where you live and those local land use decisions have some grave consequences, as is evident in the environmental data. For example, some of our residents in the Inland Empire or the inland region of Southern California live near commercial and industrial sources. For example, on the left, we see that there is a proliferation of warehouses very close and quite adjacent to a residential neighborhood. And on the left, we can see that there is a residential community right across the street from the Omnitrans natural gas bus refueling facility. In another example, we see that the community center and soccer field that services the West Side San Bernardino community is right across the street from the BNSF rail yard. These and the previous examples are quite evident of land use inequities that contribute to environmental exposure disparities and are correlated with health disparities. After seeing these inequities, I was inspired to carry out a pilot community-based participatory research field campaign that was powered by an Internet of Things facilitated wearable air pollution sensor. I used this technology to better my understanding of the individual PM 2.5 exposures and disparities in the Inland Empire region. Our participants were recruited from Moreno Valley, Redlands, Riverside, and San Bernardino, as well as the city of Yucaipa. So in this field campaign, we collected personal PM 2.5 exposure data using these highly accessible wearable monitors with a sampling rate of 15 seconds for 18 individuals over 7 consecutive days. We also collected their position with GPS data loggers with a sampling rate of 5 seconds. The wearable technology was sourced from applied particle technology. Overall, we found that the San Bernardino residents, which is our underserved community, were at a higher risk for PM 2.5 exposure in their homes. And this is despite the fact that the majority of our participants were highly mobile. I should point out here that the data recovery for the participants aggregate here was greater than 50%. The other observation of interest is the fact that personal behaviors and the visitation of somewhat high-risk non-residential points of interest also proved to have high PM 2.5 exposures, and therefore in the future should potentially be candidates for continuous monitoring. So the lessons learned from the CVPR study, highlighting the disparities in personal exposure, as well as the trends that were seen during the COVID-19 pandemic, led me to conclude that land use practices, when considered in conjunction with other overlapping vulnerabilities, should be helpful for making public health management decisions. Considering all of these sectors together could help to mitigate the multi-generational compounding impacts of isolated or confined residential spaces. And what I'm calling an isolated or confined residential space is a crowded multifamily dwelling or a residential neighborhood that is surrounded by commercial and industrial land uses. In a very positive turn of events, we actually saw that at the state legislature in California, Senator Connie Leyva recently introduced Senate Bill 499, which promises to ensure that disadvantaged communities no longer bear the disproportionate burden of pollution and environmental hazards by way of legislation that prevents further land use inequities and overdevelopment in disadvantaged communities. I was happy to see this after my commentary in Nature was published, where I made the posit that land use equity should be a priority in governments. So I'm happy to see that progress is being made at the state level to further protect those communities. Lastly, I will discuss a few calls to action related to pandemic prevention in the future. One, essential workers and their households should be targets for concentrated investment of resources related to the pandemic prevention. Some of those resources could include health benefits, vaccination, and the distribution of personal protective equipment, because this group of people were seen to have the greatest risk for infection, and they are historically under the influence of various environmental disparities. Further, in my previous research, I showed that the Internet of Things and community accessible connectivity could actually help to plan for future pandemics. By collecting and mining those data, such as temporal and spatial patterns of mobility, human exposure, or other symptoms, could actually help to identify high-risk microenvironments or behaviors that could lead to um, disease transmission. Further, we as researchers have a great opportunity to partner with underserved communities to hear and understand their gravest concerns. We then can turn those concerns into viable research. And I would like to pose that this is our 21st century grand challenge. In other words, the reversal of environmental and health impacts of systemic inequities with innovative and scalable solutions is our grand challenge. With that, I'd like to thank the workshop organizers for inviting me to speak at this session. I would like to especially thank Professor Maya Trotz for including me in this session. I'd like to acknowledge the contributors to the research and results shown in this presentation. I'm listing here my collaborators from UC Riverside, as well as my colleagues at the People's Collectives for Environmental Justice. I am like to acknowledge my funding sources for the research presented, including the Sloan Foundation, the National Center for Sustainable Transportation, and the Center for Ideas and Society. Thank you very much.